Hello, dear people. Welcome to my channel. This is Dr. Spinach. Now, we are continuing the question answer explanation, that is QAE series. And today's topic is psychiatry. Now, if you remember, I posted a question before in the shorts and in the reels as well. And the question was about the risk factors of suicide. So let's begin, having a little bit of description and explanation of the answer. Now, most of you actually gave the right answer to this question, and I applaud you all for that. So whenever we start reading the question, if you remember from my previous QAE video on ophthalmology question, we start with the last line of the question, just to orient ourselves to what we have to find in the question, right? So what among his presentations puts him at a highest risk of committing suicide? Now that means the question is asking the risk factors. Question is trying to understand if you know what are the risk factors of suicide, right? So let's just start reading this again. This question here, I'm just going to put a highlighter on my. So, okay, 30-year-old man comes to you mentioning he feels that there is nothing more in life and he wants to die. So you can see like you have a male patient, okay? So, and then the male patient mentions that he feels there is nothing more in life. There is nothing more in life. He wants to die. So the patient is hopeless. Patient has thoughts of suicide. And he's been struggling with low mood since past 6 weeks. So patient has been having, well, all of these points point towards depression in the patient, right? Now, the next thing says is he has been on therapy and taking sertraline for past 1 year. So the patient is on antidepressants and is also taking psychotherapy. He recently lost his job and turned to alcohol. So he recently lost his job. That is unemployment. That is one other risk factor of suicide. And turned to alcohol. Now, abuse of any kind of drug or alcohol is another risk factor. So until now, we have found 4 risk factors already. The patient is what? Male. The patient is depressed. The patient has lost his job, that is unemployed, and the patient is also abusing alcohol, right? On history, he reveals his mother suffers from long-term depression and once tried to kill herself. So again, we also have a positive family history of suicide attempt. Additionally, he has had a suicide attempt 3 years ago, and he consumed rat poison and was admitted to the hospital. Now, there is another risk factor that has been mentioned is that he himself tried to commit suicide 3 years ago. Another risk factor. Now, what among his presentation puts him at the highest risk of committing suicide? Now, if you all know already that what are the risk factors of suicide, which is a very, very frequently asked topic in the PLAB or in PLAB exam, which so future AKT exam as well. So you would know, like, out of all of the things that have been mentioned, what are the risk factors and what can put him at the highest risk of committing the suicide again? Okay, so your options are positive family history of suicide, unemployment, alcohol abuse, previous history of suicide attempt, and taking antidepressants. Now, all of these can be risk factors for suicide, okay? But the thing that makes someone prone to attempting the suicide again is previous history of a suicide attempt, okay? So this is the answer. And well, all the risk factors are mentioned here. So there are 5 important risk factors for suicide, and these include male gender. Well, you should know, like, male genders, so male and female both can commit suicide. It's not like they can't, but the probability of dying is more in males than in females, right? So that is one thing. So mental illness, like in this one as depression. Then you have unemployment. Again, another risk factor. Even a loss of a relationship, getting divorced is also a very important risk factor. You have alcohol or drug abuse. Then you have previous suicide attempt or attempt to self-harm, which carries the highest risk of another suicide attempt. So remember this. That's all about the question. This was the easiest question that we had. Anyway, so that is all about my question today. I hope you enjoyed it. And if you did, please like, share, subscribe, and share this with your friends who might benefit from these sessions, these small clinical sessions about the questions and the topics that are asked most frequently. Okay, you have a great day. Bye-bye. Dr. Spinach signing off.